A treatment exists that stabilizes heart tissue, clears liver fat, and reduces the urge to use cocaine. While it sounds like a future tech discovery, millions of doses are currently sitting in neighborhood refrigerators, prescribed to patients who simply want to manage their weight. Standard medical practice often isolates these issues. If your liver is failing, you see a specialist. If your heart is struggling, you receive a specific cardiovascular prescription. If you fight addiction, you enter a separate behavioral program. Those clinical boundaries are blurring because of a class of drugs called GLP-1 receptor agonists, which includes well-known medications like Semaglutide. These drugs were built for a narrow purpose. They mimic incretins, natural hormones in the gut that manage blood sugar. By mimicking these signals, the drug slows down digestion and tells your pancreas to produce insulin after a meal. For millions with type 2 diabetes, this targeted approach stabilized glucose levels. A common result was rapid loss of excess body fat. While the drug performed its localized digestive function, scientists discovered that the molecules were moving far beyond the gut. They were circulating through the entire body, finding receptors that linked seemingly unrelated health conditions. Once GLP-1 molecules enter the bloodstream, they spread to almost every major organ, searching for compatible receptors outside the digestive tract. The discovery of what they do in the heart was driven by a safety mandate. In 2008, the FDA began requiring cardiovascular outcomes trials for all new diabetes medications. This was a response to previous drugs like rosiglitazone, which had unexpectedly increased the risk of heart attacks in patients. These cardiovascular trials measured long-term heart health. Surprisingly, GLP-1s didn't just meet safety standards. They actively prevented major heart events and lowered overall mortality. This impact extended to the liver, clearing excess fat in patients with NAFLD, non-alcoholic fatty liver disease. GLP-1 activation clears out these fatty deposits, a process known as reducing steatosis. By clearing the fat, the drug stops the chronic inflammation that often leads to liver scarring and failure. The data from these trials suggests that metabolic diseases are not isolated to single organs, but are tied together by these specific receptors. While the heart and liver benefits were measurable, the most significant findings were occurring in the central nervous system. GLP-1 molecules eventually cross the blood-brain barrier, reaching the reward centers that govern our most basic desires and habits. Researchers at Washington University analyzed the health records of over 600,000 U.S. veterans to see how GLP-1 use affected substance use disorders, the clinical term for the uncontrollable use of drugs or alcohol. The study found a consistent drop in new diagnoses: 18% for alcohol, 14% for cannabis, 20% for cocaine, and 25% for opioids. For those already struggling, data showed a 40% reduction in overdoses and a 50% decrease in drug-related deaths. This happens because the drugs help silence food noise, the constant neurological preoccupation with eating. By binding to receptors in the brain, the drug reduces the mental reward associated with consuming. Scientists now believe the same process dampens drug noise. Instead of targeting a specific chemical like nicotine or alcohol, GLP-1s appear to stabilize the biological mechanism of craving itself. By lowering the intensity of these cravings, GLP-1s demonstrate that metabolic health and psychological addiction share the same biological foundation. Researchers are now moving beyond the use of a single hormone mimic. We are entering the era of Twincretins. These are new drugs, like Tirzepatide, that combine GLP-1 with a second gut hormone called GIP. This synergy creates a combined effect that increases weight loss and glucose control beyond the capabilities of either hormone alone. GIP, or glucose-dependent insulinotropic polypeptide, works alongside GLP-1 to sensitize the body to insulin. GLP-1 research has shown that our organs are part of a deeply interconnected network. Medicine has traditionally treated the liver, the heart, and the brain as separate silos, but these receptors prove they are physically linked. A drug developed to manage blood sugar has become a broad biological regulator. As we learn more about these systemic connections, we are beginning to map out which diseases this technology will stabilize next.